In this video, we'll talk about Murphy's sign. It's also called as Naunyn sign, right? So it is a hypersensitivity which is elicited by deep palpation in the subcostal area when the person with the presumed gallbladder disease takes a deep breath. So we'll ask the patient with the gallbladder disease to take a deep breath and will palpate in the subcostal area. Then we can elicit this Murphy's sign. So let us see what is a Murphy's sign. This is a mid-inspiratory arrest or the shutting off of the inspiration on palpating at the subcostal area. So it is seen in acute cholecystitis due to the inflamed gallbladder which comes in contact with the abdominal wall when we depalpate it. Right? So when we depalpate in the subcostal area, this gallbladder will be coming in contact with the abdominal wall. It will produce this pain which will be leading to inspiratory arrest. So this mid-inspiratory arrest or the shutting off of inspiration is called as Murphy's sign. So it is elicited when the patient is asked to take deep breath and examiner should palpate in the right hypochondrium. And there is something called a sonographic Murphy's sign. It is same Murphy's sign, but instead of palpating with the hand, you use the sonographic transducer. It is usually done in the diagnosis of acute cholecystitis. When you are doing this ultrasound, you keep the sonographic transducer in the right hypochondric region and the patient is asked to take deep breath. And when you try to palpate it with the transducer in the right hypochondric region, the patient will be having pain, which leads to inspiratory arrest. So this is called a sonographic Murphy's sign, which is elicited using this sonographic transducer. So it is same but elicited using sonographic transducers for the diagnosis of acute cholecystitis. When the probe is placed in the right hypochondric region, the patient will be having mid-inspiratory arrest. This is called as sonographic Murphy's sign. And the other one is Moynihan's modification of the Murphy's sign. So normally this is how we palpate the Murphy's sign. This right hand of the doctor is kept in the right hypochondric region and depalpation is done and the patient will be having this mid-inspiratory arrest. It's called as Murphy's sign. But in the Moynihan's modification of this Murphy's sign, this is how you elicit it. So the patient will be lying down. The patient will be lying down and the left hand of the examiner is in the right anterior ribs. Right? So index on the most inferior rib and the abducted thumb is in the right subcostal region. So if you see this picture, the left hand of the doctor is over right anterior ribs of the patient. Right? So the index finger is at the inferior rib and this thumb is at the right subcostal region. So this abducted thumb is at the right subcostal region. So on taking deep breath, the gallbladder which is distended will touch the thumb. Again, the patient will be having inspiratory arrest. So it is called as Murphy's sign. Right? So if you want to buy this whole PDF which has all the important questions for university exams which I made using this SRB and Marrow, you can text me on the Telegram. Bye.